If you've got health care already, then you can keep your plan if you are satisfied with it. If you like the plan you have, you can keep it. I intend to keep this promise. If you like your health care plan, you'll be able to keep your health care plan. If you like your plan and your doctor, you can keep them. You'll be able to keep your health care plan. If you like your plan, you keep your plan. If you like your doctor, you like your plan, you can keep your doctor. You can keep your plan.
I'm afraid we're going to have to jump in here because this goes on for 3.5 minutes.
Oh, boy.
As 36 times the president said that or various versions of it. And I've always been annoyed by the fact that, well, it was the lie of the year, according to PolitiFact.
2013, a fine year for lying.
Millions and millions of people didn't get to keep their doctor or their plan, and now I am among the millions of people that are not going to get to keep their plan or doctor. As we found out yesterday, our particular hospital we go to is not covered by our insurance anymore. Now, whether that's a fault of this or not, we're about to find out. But I don't get to keep what I had.
Judy's opening the mail. She comes across this letter that comes from our insurance people saying our health care provider, which is a big group, ain't working with them anymore. And we received it on January 3rd. It was effective several days prior. And I was thinking, wait a minute, how does that happen? How do you not get a notice 6 months in advance or 3 months in advance?
That's what my wife said. They don't tell you ahead of time, so you can shop around
afterward.
So the letter shows up yesterday. I actually have sick kids right now with a cold. Right. No big deal. But you go check to see if you got an ear infection or whatever. I could have gone and found out I have no insurance for that.
So we headed straight to the source of the information on this sort of thing for the Armstrong and Getty show for quite some time. Our friend Craig Gottwals, Craig, the Obamacare lawyer, to ask him what the hell's going on. What do you make of this? And Craig joins us now. Howdy, Craig.
Good morning, gents.
Oh, we should point out that it's not just us and we're complaining on behalf of ourselves.
Oh, right. Yeah, good point.
There are many people that you either got the same letter or are getting the same letter or it's in your mailbox right now.
So, Craig, what happened, do you suppose, and what is the greater significance of it?
Well, welcome to the world of bureaucratic and government-driven healthcare, folks. This is all related to not just Obamacare, but Medicare and Medicaid, and the overarching principle here is that more and more people are covered by government health care. Government health care does not reimburse what doctors want to receive. Whether you're talking Medicare or Medicaid, a doctor gets 50 cents to 80 cents on the dollar compared to what a private employer plan would pay.
And just a brief aside, in your opinion, for instance, Medicare compensation rates, are they fair to doctors or are they dirt poor? I mean, really low?
Well, you picked an interesting one. So Medicare is the one that it's the higher end. Medicare covers our oldsters, and Medicare, depending upon your state, covers about 80% of what pays a doctor about 80 cents on the dollar for what your private employer plan would pay. And I've spoken to many hospitals and medical facilities that say, yeah, we can make a profit on Medicare, but it's rough. Medicaid is about 30% less than that, and that's the one that's dirt poor, dirt cheap, and makes it incredibly hard for a doctor to make a living.
I see.
Obamacare reimbursements are somewhere in the middle, somewhere between those two. So no matter which government program you're talking about, doctors make less money than they would make in the open market, or in some cases, less money than they can even make at their raw bottom cost level. Okay?
Right. Okay, so go ahead.
I don't want to make it too complicated for those of us who don't have Obamacare, Medicare, or Medicaid who found out we don't get to go to the doctor we've had anymore. What's up? I mean, what do we do?
So what's this is perfect cost shifting. This is what we would call a hidden tax deep within Obamacare, Medicare, Medicaid, any kind of government health care. Because we have more people going on government health care, because government health care artificially low reimburses doctors, medical groups and doctors like you guys are experiencing are forced to negotiate higher rates with insurance companies, right? Well, that can't work forever because employers can't afford the ever-escalating costs of insurance. And, oh, by the way, we still do have the Cadillac tax on the books that's coming out there, so employers are also a little bit worried about, we can't have our premiums going too high. So what happens is we start cutting out the centers of excellence and the highest cost providers. And here in Northern California, there's a very large, very popular high-cost provider that's having a huge fight right now with a number of large insurance companies. And so you guys get the letter. I mean, the rubber meets the road, and something has to give and something has to break. And so what you guys are experiencing is that. It's the hidden tax of government health care.
Well, and this is straight out of your econ textbooks, in that the government said, listen, we provide health care now for X percent of the population. We're only paying this. Free market be damned. I don't care if a doctor can make a living. We can't get it through Congress if we compensate doctors and health groups at a realistic level. So we're going to pretend that we can give doctors 60 cents on the dollar. That's
exactly right.
Right, exactly. And the doctors are saying, what the hell? We got to see these people. I'm quitting being a doctor unless these people over here pay us $1.10 on the dollar. And entire health groups are saying that, and that's the tax you're paying, the hidden tax Craig's talking about.
So what is for anybody who's in a situation like me, for instance, where I've had the same doctor for years. My doctor is my kid's doctor since the day they were born. All my cancer doctors are in that place that I see on a semi-regular basis still. So what does a person do? What's it if I want to keep going to the same doctors? What's it like to go out and just buy your own insurance? Is that insanely expensive?
Oh, you would not like or want to do that, Jack, because you do have subsidized health care from your employer at work. So you'd have to go to an exchange, for example, and pay an open market price, which would be higher than what you're paying at work, and it would have a smaller network anyway. It would probably not include those same doctors that you want to do right now because of the same exact problem.
So the opportunity to continue seeing the doctors you had before is really not there for anybody who got these letters.
Well,
depends how much money you have.
Well, if you're insanely rich, but most
pieces of advice.
Let's talk to almost everybody who's listening right now.
Well, no, I am because if they pay 80% of the whatever, if it's in plan, maybe it's 50% of the whatever out of your network. So you're not paying all of it. It's incremental, and sometimes it's significant, but you don't have to be super rich. It's just more expensive. Is that more or less correct?
Yeah, that's right, Joe. I mean, what you can do, Jack. So 2 pieces of advice, just 2 basic pieces here. One thing I would do is anybody who got one of those letters on the 1st, which those letters happen with regularity and more increasingly in Obamacare, what I would suggest is don't go to the doctor in January if you can avoid it. Usually these things are worked out by February.
So this is like a spat where Fox can't come to terms with Dish Network or something like that?
Exactly.
On your TV?
It's exactly that.
Okay.
Yeah, and it's just going to happen more and more because of the prevalence of government health care. That's right.
And then I missed The Simpsons.
So for anybody listening who either got the letter or it's in your mailbox or you're about to get it, that you don't get to go to your doctor anymore, you're saying try not to go to the doctor for the next month or 2.
Be healthy.
And see if it works out.
If it's not urgent, try that. Now, if that's not an option, and you're talking about just going to see your general practitioner, Jack, somebody like you have, you can always call that office and say, hey, look, you're out of network now on my plan. I have a PPO, for example, which I believe you guys do.
Can I bring you a chicken and trade it for your services?
Well, will you accept this with a reasonable amount from me to continue seeing you? Because that plan you have will still pay something to that doctor. It's just going to pay less now, and your doctor can take the difference from you. And if it's a doctor you've had for years and years, they're likely to take an arrangement like that, especially if they think they're ultimately going to settle with large insurer. Or you got to just pick a new doctor. And for most people, that's going to be the case because hospitals, Jack, is the issue. Like you can negotiate that deal with your family doctor. That's usually not that difficult. It's okay, now I need hospital care or whatever that becomes very pricey, and you're just going to have to switch medical groups for that part.
Yikes. So in the interim, just in case you break your leg, you better figure out which podunk or God help you hospital is included in the new regime.
Right.
So,
and then
lovely.
And then, because so if you're taking your kids in for, just regular stuff, ain't that expensive. But then all of a sudden you take them in one day, we got to check them in. They're really sick. Yeah. Okay. Now what do I do?
Craig Gottwals is on the line. Craig, the Obamacare lawyer. Finally, Craig, in the limited moments we have, because Jack's going to teach us how to all be sharp as oldsters. What do you see coming down the line Obamacare-wise with the new Congress and everything?
Well, we can only see improvements at this point. I think Dr. Price is a good choice for HHS. He's a limited government Tea Party conservative type of fellow who understands healthcare, and he wants to get in and make some cuts and some tweaks. And I do think we're going to see improvements, and I think they could be dramatic improvements over the next couple of years.
No, I'm glad to hear that because I'm quite cynical, and I look at the wrangling going on, and I think, Is something better going to come out of this? And you're saying yes.
Well, yeah, better for sure. But remember, healthcare was already a mess in 2009 before we started down this path. So it's still going to be very challenging.
That's one of the reasons for my skepticism is I think people tend to forget it was not headed in the right direction before all this.
It wasn't, and Obamacare speeded us into the wrong direction, and I think now we're actually going to turn it around and start heading the right direction, but we have a long path ahead of us, as you guys know. Yeah,
lovely. Well, something to look forward to for 2017. Craig Gottwals.
We got another moment, Joe. I got to share something with you guys. New law in California for healthcare on this topic came out. It's effective now for 2017, and it said basically what the law was intended for was if you go to your doctor, if you go for a planned surgery, and you get a surprise anesthesiologist that happens to treat you from another network, you get this crazy bill that's out of network and really large, right? I think Jack's experienced something like this before. Well, California passed a law. If that happens to you, that provider must accept 125% of Medicare and let that be considered full payment and cannot come after you for a balanced bill. However, the law went on to say, but we in California say this is only for this limited circumstance. If you have an emergency or any other situation that comes up, we are in no way saying that 125% of Medicare is adequate or reasonable payment for a physician. So what that means is in California, we've codified into a statute that Medicare is so low that 125% of Medicare cannot be considered full payment legally.
Yeah, wow, that's wild. And it gets to the great problem of this country, if we're going to be honest with each other, that we're demanding $1.35 worth of government for 80 cents of taxes.
Sure.
And everybody in D.C. in your various state houses is more than happy to deliver it and stick the kids with the bill. But democracy, the worst form of government, except for all the others. Craig Gottwals, Craig, the Obamacare lawyer. If you need help in negotiating the world of benefits and your company needs help or whatever, we'll put you in touch. What's your website?
Benefit-revolution.com.
That's right. All right, Craig, thanks, man. Good to talk to you.
Thank you, guys.
See you later.
Yeah, well,
Tell you what, it's stressful.
Heck yeah.
It's stressful if you have money.
I'm pretty gun-shy on the whole picking up my chunk of it, having been hit with that $22,000 bill last year.
Yeah.
I just worry about that happening.
Yeah.
You know.
I think the average stuff, a strep throat culture and whatnot, will just be...
I hope so.
It's not going out to eat this week.
Me and everybody else doesn't... nobody has any idea what any of this stuff costs because we've never dealt with it on an actual paying for it basis. We all should. That'd be the best way to know. We should all have an idea of what's an ear infection cost. I don't know. I don't right now have the slightest idea, even though my kids have gone through it. I don't know how many times. I don't know if it's $50, $500, or $5,000.
See, I do because the guy who gives me my smoothie enemas is out of network. So it's amazing. You absorb the nutrients. You feel like $1 million. I recommend it to anybody.
If you get a little bronchitis and need, some antibiotics.
Right.
Is that going to be $100, $1,000, or $10,000? I don't know.
Ain't nobody got money for that. With the bronchitis.
Would you like to be a super ager?
Yes.
Please. Have your brain stay sharp well into old age. They think they know why some people's brains do and some people's brains don't, and there's something you can do about it. It's not just genetics. They think. Stay tuned for that coming up on the Armstrong and Getty Show.